Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please let me know in the comment section. Thank you very much. Good evening, everyone. Such a beautiful day today. Today we get to meet, we get to talk. Life is really beautiful. Is my voice coming to everyone? Please let me know in the comment section. Sorry, I'm 3 minutes late. Actually, actually video buffer होने में time लगता है. Started. Video is started. Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Today is a beautiful day. We get to share some immense amount of knowledge. My name is Dr. Anand. I have done my MBBS from Rajiv Gandhi University. Did my MD from GMU Muradabad. Then I did my SR-ship from Lady Harding Medical College and NDMC Medical College. Then I became assistant professor. Then I realized that life is really beautiful. Then from last 7 years around, I have this beautiful teaching experience. We take batches for UG, PG, DCH and MRCP CH. Today is a beautiful day. Why? Because the topic is growth and development, and the subtopic is we're going to talk about some syndromes, and also we're going to talk about dentition as well as X-ray wrist. Yes. Good evening, beautiful people. Good evening, Bhavna Mankar, Akash, Shubham, Shivam, Shiv, Akash, Sushmita Model, and Shubhangi Kaushik, Osama, my favorite juniors. Life is really beautiful, guys. I hope you are just enjoying this beautiful thing of life, the journey of life. Before starting any amazing segment, we always have a motivating quote. And today's beautiful motivating quote is, my dear friends, whatever you do, whatever you decide to do, make sure it keeps you happy. Whatever you decide to do, bro, life is really beautiful. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है, तो इसलिए आप जो भी करें, make sure कि आप खुश रहें. Life is the most beautiful thing on this planet. Make sure you enjoy every single moment of life, guys. So whatever you do, bro, whatever you do, make sure it keeps you happy. Okay, make sure it keeps you happy, because if the problems will come, happiness will come, sadness will come, hurt will come. And there's a saying, beautiful saying, which says that if the hurt comes, so will the happiness. If the hurt comes, so will the happiness. Guys, life is really beautiful. I want you guys to appreciate every single moment of life. It's really beautiful. And thank you so much for all the love and support. Recently we had booked the audio of 600 students. Again, the class was super hit. Thank you so much for all the love and support. You guys are amazing. Let's study something beautiful. I remember this was something we're going to talk about in today's class, and some beautiful amazing topic. Yes, Dr. Shubham, I really missed you. Shivam says 1 hour please. Okay. Anjay Gupta, beautiful amazing people we have today. Let's just learn something in today's class. PGI November 2017 question, my guys, can you please have it? The causes of microcephaly, including is or are, how many are there? It's a beautiful PGI November 2017 question, my dear. So the options are galactosemia, Weaver syndrome, Rett syndrome, Soto syndrome, and Morquist syndrome. A beautiful, easiest question on this planet. As this is a PGI question, so you all know that in the PGI questions that multiple options are correct. Let's talk about one by one. Galactosemia. Can you please answer me in the comment section? Galactosemia causes what? Microcephaly or macrocephaly? Can you beautifully answer in the comment section, please? Yes, Grace. I missed you too, Grace. Shubham, Shubhangi, Osama. Beautiful, amazing people. I had classes in Delhi and Hyderabad. That's why I was traveling like crazy. And I had a class in Delhi in Gautam Nagar in the DPJ and NLC batches. There also I was busy. Tomorrow also I have a 12 hours class. That is why I was not able to come online. Okay, so the causes of microcephaly is or are galactosemia. Yes, that's beautifully put. Please remember, galactosemia, the patient will have macrocephaly. This is the latest update according to the OPGHI 9th edition. In the causes of macrocephaly, galactosemia is there. Okay, this is a recent update, because in the previous books they had given that galactosemia has microcephaly, but now the latest books have nothing but galactosemia has macrocephaly. I am a NEET PG and FMG students. Can you please beautifully tell me one beautiful amazing thing that what you call galactosemia? Can anyone tell me in the comment section galactosemia, like what are the beautiful points of galactosemia? Can you answer me in the comment section? Any other specific points I must know? Yes, so beautiful, amazingly everyone is answering. Yes, Karan, kaisa hai Karan? Tu main theek hu bro. Okay, beautiful. Yes. So galactosemia. Number one, Galactosemia is the absolute contraindication of breastfeeding. Number one. Yes, exactly. Okay, great. Sounds beautiful. Galactosemia is an absolute contraindication of breastfeeding. That is one beautiful important point we must really appreciate. In the absolute contraindication of breastfeeding, we have contraindication in the baby, contraindication in the mother. In the baby, I hope you know that galactosemia and lactose intolerance is there, and absolute contraindication of breastfeeding in the mother is that if the mother is on chemo or radiotherapy. Galactosemia, we all know that. Quick points if I talk about, the more the mother will feed her child, the more lactose or milk related products the mother will feed her child, the baby will expire of hypoglycemia. The baby will expire of hypoglycemia. Yes, I hope you know that. Beautiful, beautiful. Why the baby will expire of hypoglycemia? Because in the beautiful, normally what happens, my dear, normally what happens, the more the mother will feed her child, that is nothing but the more dairy products you will give, like lactose, milk and all those things. Normally this galactose gets converted into glucose with the help of galt enzyme. We have something known as galt enzyme. Whatever the mother will feed her child, this galactose will get converted into glucose with the help of galt enzyme. This is normal. Whereas beautifully in a case of galactosemia, we have a beautiful deficiency of the galt enzyme. When this enzyme is deficient, whatever the mother will feed her child, the galactose will not be able to get converted into glucose. That is one basic thing you need to know. Okay, the galactose will not get converted into glucose. That is what is the important thing. So more the mother will feed her child, the more this enzyme is deficient, more and more galactose, more and more galactose, more and more galactose. So galactose will get kind of what you call accumulated in my eyes, and it can cause cataract. Very, very important. Can you please answer me in the comment section, what kind of cataract do you see in a case of galactosemia? Yes, hello Dr. Rashmi, beautiful. Okay, yes, that's very well put. Karan says, I am in metro. Hi Karan, how are you, mere pyare bhai? Yes, that's true. Oil drop cataract. Oil drop cataract. Very beautifully put, Shubhangi Kaushik, one of our favorite students. She's very right. In a case of galactosemia, we see oil drop cataract. And can you beautifully answer in the comment section, where do you see sunflower cataract? I think you know that a sunflower cataract you see in a case of Wilson disease. Yes, Rashmi, you are right. The beautifully answers have been given by Himanshu, Osama, Shreya Gupta, Anand Pillai. Then we have Karan, Grace, Dr. Awesome, Vishwas, and Dr. Shiv. So sunflower cataract you see in a case of Wilson disease. Oil drop cataract you see in a case of galactosemia. In galactosemia, there is a galt enzyme deficiency. So the galactose will not be able to get converted into glucose. More and more galactose in my liver causing liver damage. In my brain causes macrocephaly. In my eye, it gets deposited the galactose. In my eyes, it gets deposited causing oil drop cataract. And that's it. And the baby will have hypoglycemia. So this galactosemia, beautifully put, the answer is macrocephaly. The baby will have macrocephaly. So that's very well put. The first option has been beautifully, amazingly covered, that galactosemia, what you called the patient will have macrocephaly. And here, see, that's the beauty of this class. In every class we will try to cover the topic as a whole. Okay, so galactosemia, now it's a 5 marks question also. Beautifully you can answer amazing stuff on galactosemia, that galactose get converted into glucose with the help of enzyme galt enzyme, and that is deficient in a case of galactosemia. One beautiful answer. One more question I would like to ask here, because that will finish the whole topic of galactosemia. What is the treatment of galactosemia? Can you beautifully answer in the comment section, please? What is the treatment for galactosemia? Any idea? When this galt enzyme is deficient and all those things, so any idea what is the treatment for galactosemia? Can you answer in the comment section? Yes, okay. करण सेज सोटोस का तो स्केच बनाया था मैंने. वो तूने बनाया था करण? अभी भी याद है, मैंने तेरा नाम लिखूंगा यार. मुझे नहीं पता था कि, मुझे याद ही नहीं था कि तूने बनाया वो वाला. मैं तेरा अभी नाम लिखूंगा मेरे सोटोस में, और हर क्लास में बोलूंगा कि मुझे करण ने बना के दिया ये. दैट्स ब्यूटीफुल. रश्मि कुमारी, yes, everything is beautiful. So yeah, exactly. Can you say lactose free diet? Obviously the problem is the lactose, no? So lactose free diet, free diet I would like to give, right? Exactly, that's very well put. Dr. Osama, not gluten-free diet. Gluten-free diet will be in a case of celiac disease, of course, but a celiac disease may be give gluten-free diet because in celiac there is gluten sensitivity, whereas in this case the galactose and lactose, that is like one thing which is getting accumulated. The beautiful answer will be that stop the breastfeeding, and you can say low lactose formula. Yeah, I remember that. We have a there's a formula feed known as low lactose. Even soy based milk also we have, okay, and low lactose also for diet like formula feed we have, and that is what you need to answer. Okay, Dr. Yash Sharma says big fan, sir, big fan of yours. Thank you so much, Dr. Yash Sharma, that is very sweet of you. I'm nothing without your support. Thank you so much for everything. Next one is we were. So what do you think, bro? Weaver syndrome causes what? Macrocephaly or microcephaly? Can you beautifully answer in the comment section, please? Weaver syndrome causes what? Yes, beautiful. Okay, yes, Dr. Samriddhi Keshkar is beautifully right. In a case of Pompe disease, enzyme replacement therapy, that's very well beautifully put. Even enzyme replacement therapy is there in there also. Where else? In the Klinefelter syndrome also, there is a testosterone replacement therapy. I hope you know that because in the Klinefelter, you will have a decreased testosterone level. So testosterone replacement therapy is available for Klinefelter syndrome. And enzyme replacement therapy is there for Pompe disease. That's very well put. Weaver syndrome. Who is Weaver? Who is Weaver? So Weaver syndrome, very, very important. Number one, the patient will have a tall stature with or without macrocephaly. Beautiful. Weaver syndrome definitely will have a macrocephaly. Imagine a tall patient with a macrocephaly. Very, very important. Can we link and study, please? If I say a tall stature with the micropenis, what will you write and come? Any idea? Dr. Shubham, Shubhangi, Karan, mere pyare bhai Karan, Samriddhi, Sushmita Mondal, and Shubhangi Kaushik. So yes, that's beautifully put. Tall stature with a micro penis. You must think of Klinefelter syndrome. Yes, that's very well put. Klinefelter syndrome. What is the karyotype of Klinefelter syndrome? Can you answer in the comment section, Dr. Anand? Yes, tomorrow we're gonna have a class in Delhi. 12 hours class, morning 9:30 to evening around 7 8 o'clock. Will have a class. Yes, Dr. Priya Gupta is beautifully right. Tall stature with a micro penis. You must think of Klinefelter syndrome. Klinefelter syndrome, the karyotype is 47XXY. That's very well put. And yeah, that's very well put. Beautiful, beautiful, amazing, amazing, Dr. Samriddhi. And yeah, Himanshu is also right. Perfect. And tall stature with a macrocephaly, you'll think of Weaver syndrome. Okay. And remember one basic thing. Okay. Mostly all the syndromes will have intellectual disability. You don't have to learn this. Mostly all the syndromes will have intellectual disability, except I think that is 1,000 times we have done this question. If you attend my classes, no, the best part is you revise so hell amount of times that literally like midnight 2 o'clock also, if I ask you in which syndrome the IQ is normal, sir, in Turner syndrome IQ intelligence is not affected. And also in a case of Treacher Collin syndrome also intelligence is not affected. How will I remember, sir? T bro, T. Okay, T are always toppers. T are always toppers, like they, because their intelligence will not be affected. So Turner syndrome and Treacher Collin syndrome, the beautiful intelligence will not be affected. That's very well put. Very well put. Very well put. Very well put. Okay, that's nice. Perfect. अच्छा और क्या था? हाँ. So what else? Yeah. This is a beautiful picture. This is a beautiful picture of Weaver syndrome, my dear friends. This is the beautiful picture of Weaver syndrome. Yes, that's very well put. That's very well put. Yes, very right. So, can you answer in the comment section, please? What is this? What you called? What can we appreciate in this? What you called Weaver syndrome? Yes, very good, very good. Weaver syndrome, as you can see, very well, beautiful. Can I say kind of an anti-mongoloid slant, downward deviation of eyeballs? Very well put. Yes or no? Can I say a low set ears? If I draw a straight line, kind of, can I say a low set ears? Number one. Number two, anti-mongoloid slant. Very beautiful. And almond shape eyes. This is also very classical picture of Weaver syndrome. Weaver. In our classes we'll finish all the beautiful syndromes. Okay, bro, that's what. So number one is hypertelorism. What is hypertelorism? Abnormal large distance between the two eyes. This one, can we see that abnormal increase large distance in the two eyes? Very importantly, photographic memory, bro, tell yourself you have a mind-blowing photographic memory. Okay, so that's the beauty of this whole question. The patient will have a hypertelorism, increase in the distance of the eyes. Number one, the patient will have a almond shaped eyes. That's again beautiful point. Almond shaped eyes. Number one, anti-mongoloid slant, that is nothing but downward deviation of the eyeballs. That's very well put. And also the patient will have have, yeah, hypotelorism over, downward slanting of eyes, nothing but anti-mongoloid slant over. Then what else? Yeah, that's beautiful. Almond shaped palpebral fissure. Almond shaped palpebral fissure. Beautiful question. कौन बादाम खाता है? How many of you take almonds every day? Please let me know. Yes or no. Do you take almonds? And how many you take almonds? The option are 5, 10, 15. How many almonds, bro, you take in a day? Can you please answer in the comment section? Yes, that's right. करण विक्रम सिंह, मेरा प्यारा भाई करण, बहुत प्यारा सा है, छोटू सा है करण, क्यूट है. Frankfurt plane, yes, Dr. Karan, you are right. Hennebert says, sir, in rubella transmission risk in the first trimester is 80% and third trimester is 90%. Yeah, so Dr. Shiv, congenital rubella syndrome in the third trimester, I'm sorry to say, but congenital rubella syndrome has the maximum defects in the first trimester. Everyone knows about it. If the mother is less than 11 weeks pregnant, if the mother is pregnant and in the less than 11 weeks period of gestation, if the mother get a rubella infection, there are 80 to 90% chance that the baby will be defected. And after 11 weeks directly, it goes to 33%. After 11 weeks, there are only 33% chances that the baby will be having some congenital defects. Congenital toxoplasmosis will be very bad in the third, will be very severe in the third trimester, and congenital rubella will be very severe in the first trimester. So how many of you take almonds? Okay, we have a nurse's word. She takes, she says yes, very good. Sushmita says yes. Rashmi Kumari, yes. Okay, Rashmi says she takes 3 almonds in a day. 3 almonds, what is 3? 3 तो मेरी किडनी में छुप जाते होंगे, मुझे पता नहीं चलता होगा 3 कहाँ चले गए. 3 is very less. I expect 5 to 10 almonds, guys. Please take 5 to 10 almonds in a day. As I go to gym, I have increased to 15 almonds per day. You can take 7 in the morning, 7 in the evening. It is very nice. Okay, Osama says I take 1 ounce of almond. Pistachio, ayo, what is pistachio in English? In Hindi, raisin. Okay, raisin means kishmish, and walnut means akroot. Akroot होता है ना, walnut. Okay, nice. Okay. That's very well put. Okay, Hanji. So again, a beautiful question, guys. So Weaver syndrome also will have macrocephaly. Galactosemia also will have a macrocephaly. What about Rett syndrome? Can you beautifully answer in the comment section? Yes, Rashmi says मुझे लगता है ज़्यादा प्रोटीन हो जाएगा. हाँ ठीक है, आप थोड़ा कम करो, जो जिम जाते हैं उनके लिए बहुत अच्छा होगा. Rett syndrome, yes, we have done 1,000 times. We have done this Rett syndrome 1,000 times. Can you beautifully answer in the comment section, please? Rett में क्या क्या होता है? Who will answer? Who is the beautiful person who will answer? Rett syndrome, I think we have done 1 million times Rett syndrome. The beautiful picture of Rett is this one, bro. Number 1, the patient with nothing but an X-linked dominant inheritance. The classical Rett we have is hand wringing. Yes or no? The patient will have a hand wringing movement. She'll have a motor apraxia. That's the beauty of this beautiful. This one, your patient are your real teachers. Your patient are your real teachers. And the patient will have apraxia. What is apraxia? Very, very important. Difficult motor. Motor matlab difficult to do motor movements. Motor means nothing but muscle. So muscle movements basically is a problem with there. Okay. And it is common in girls. X-linked dominant inheritance, hand wringing movements, apraxia. What else? Any other points of Rett syndrome? Very fast. Yes, let's kill this topic, guys. Pediatrics is the most easiest topic on this planet. I am trying my best to make pediatrics like a piece of cake. Do you like cake? Which cake do you like? I like have more ka aata hai wo, golden fantasy cake full of sugar, and that's beautiful. Great. और क्या था? What else? Other points? Yes, acquired microcephaly, my dear friends. Yes or no? Will you remember this? Acquired microcephaly. Yes, the patient will have acquired microcephaly. Developmental regression. Yes, Dr. Karan Bikram Singh, bro, I'm so proud of you, Karan. That's right. MECP2 gene mutation. That also very beautiful point. Yes, and Shubhangi Kaushik has a beautiful point. The most common cause of death in Rett syndrome is very importantly cardiac arrhythmias. So X-linked dominant inheritance, hand wringing movement, apraxia, acquired microcephaly, developmental regression, MECP2 gene mutation, and the most common cause of death is nothing but cardiac arrhythmias. If this 10 points you write, no, if a 5 marks question come of Rett, you will get 4 marks because these are like the key features of Rett syndrome. Next question, please. Beautiful picture of hand wringing movement. Will you remember this for me, please? Hand wringing movements, midnight, 2 o'clock. Also, if I wake you up and ask you, where do you see this hand wringing? Hand wringing means hand movement, motor problem, muscle issues. That's what. Okay. Yeah. So the patient will have a microcephaly, acquired microcephaly. The beautiful question, guys, will you remember this? Rett syndrome will have a microcephaly. And which microcephaly, my dear? Acquired microcephaly, acquired microcephaly. Okay. So galactosemia, macrocephaly, Weaver syndrome, macrocephaly, Rett syndrome, microcephaly. Three syndromes, three beauty. The beauty of this class, we have covered the beautiful syndrome. Are you remembering this? Yes or no? Beautiful. Dr. Himanshu Sharma says, hello, sir. इतनी लेट आयो, बारात आई है तुम्हारी हिमांशु, इतनी लेट क्यों आया तू? इतनी लेट क्यों आया? चप्पल कहाँ है मेरी? चप्पल कहाँ है? इधर चप्पल नहीं दे मुझे। वैसे चप्पल से तो शुभम मार खाता है हमेशा। ट्राई टू कम ऑन टाइम प्लीज, थैंक यू। Himanshu is right. Himanshu, we have two Himanshus. Okay, that's nice. Nice. In my MBBS third year batch, there are four Himanshus, and one of my favorite junior is one Himanshu. I don't know his full name, but he is from, where is he from? Palwal, Panipat, somewhere there. Okay. Yeah. Soto's syndrome. Soto's syndrome. Yes, this is one beautiful syndrome. And can anyone guess that who has made this picture? Can anyone answer in the comment section who has made this picture? Yes or no? Sushmita Mondal, nurse's word. Yes, that's right. Anand. Yeah, Anand, as in we have a student named Anand. Yes, yes. So that's very beautiful put. Karan ने डॉक्टर करण विक्रम सिंह, यस वेरी ब्यूटीफुल। पता नहीं, मुझे याद नहीं, करण तूने बनाई थी? मुझे याद है एक लड़की ने बनाई थी पिक्चर। ओके, ओके, दैट Himanshu is from Bhiwani, that's right. Soto syndrome, guys, such a beautiful syndrome. Can we quickly finish the whole pediatrics? Tell me 10 points about Soto syndrome, bro. Can I write macrocephaly? Yes or no? Number one, the patient will have a macrocephaly. Number two, the patient will have flushed cheeks. The patient will have flushed cheeks. Number three, the patient will have pointed chin. The patient will have a pointed chin. So macrocephaly, flushed cheeks, and pointed chin. That's the beauty of this beautiful picture. Karan, I must say you have a beautiful, amazing drawing, and this very beautifully Karan has made. Yes, and also one more thing. Also, yes. Can I say natal teeth? Yes or no? Will you remember this natal teeth? Yes, yes, yes. Yeah. ओके, करण से कह रहे सर पूरी लेबल के साथ है नोट्स में। करण, वेरी गुड करण, रियली प्राउड ऑफ यू, बहुत अच्छा कर रहा है तू। नेटल टीथ, दिस इज वन ऑफ द कॉजेज ऑफ नेटल टीथ। आई होप यू नो दैट द कॉजेज ऑफ नेटल टीथ, न्यूबॉर्न बेबी हैविंग टीथ, यस और नो? Normally a newborn should not have teeth. Okay, if a newborn have teeth, number one, it could be physiological. Very important question, this was already an exam question. A newborn baby was found to have one teeth, what will you do? Normally nothing to do, it's just reassurance and conservative management. Sometimes a newborn might have a teeth, number one. Number two, you can extract it if it is kind of, you can extract it if it is, what do you call, interfering with the normal daily activities of the baby. Kind of it is obstructing the airway, or obstructing, causing some difficulty in breathing, some problem if it is creating, then you extract it. Otherwise you don't extract it. It could be physiological, conservative management is required, nothing to do for this baby. But if the other causes the mnemonic is P, I hope you know that P is nothing but Pierre-Robin syndrome. Number one, Pierre-Robin syndrome. E for Ellis Van Creveld syndrome. Ellis Van Creveld syndrome, very very important. Another E is epidermolysis bullosa. Another E is epidermolysis bullosa. And S for any idea? S से क्या होता है? Soto's syndrome. Soto's syndrome. Soto's syndrome. So Soto syndrome यहाँ पे आ गया. Soto syndrome came over here. So that's the beautiful thing. Yeah. Samriddhi says aspiration can happen with natal teeth. No, dear, like that's what I'm telling you, know that, bro. Natal teeth, nothing to do unless it is obstructing or interfering with the normal daily activities. The causes of natal teeth are Pierre-Robin syndrome, Ellis Van Creveld syndrome, epidermolysis bullosa, and Soto syndrome. And can you answer any one more thing? Any other point are we missing here? Any idea? If you answer this, if you answer this, then do you know what is in my hand? What is this? Can you answer in the comment section? What is this? What is this? What is this? Yes. Yeah, what is this? Any idea? Yeah. So that's very well put. That's right. So this is one of my junior. Yesterday I had a class of NLC in Gautam Nagar. So there only one student. His name is Dr. Nitish. He gave me this chocolate. So that's beautiful. So the answer is, yeah. Any idea? The extra point of Soto syndrome is LGA. Very very important. Okay, LGA. The patient will have a large for gestational. The patient will be LGA, large for gestational age. One of the causes for large for gestational age baby is Soto syndrome. Yes, exactly. ठीक है. Nurses say dairy milk. Yeah, that's right. These are the beautiful causes of Soto syndrome. And what did we understood? So बात की एक बात we understood. Soto syndrome will have macrocephaly. Soto syndrome will have macrocephaly. So galactosemia, macrocephaly, Weaver syndrome, macrocephaly, Rett syndrome, microcephaly, Soto syndrome, macrocephaly. And yes, that's right. And Morquis syndrome, last but not the least. Yes, beautiful, Dr. Karan Vikram Singh. So Morquis syndrome क्या होता है? These are the real patient with Soto syndrome. Very beautiful slide. This is like a pointed chin, pointed chin, pointed chin, pointed chin, pointed chin, macrocephaly. The patient is having flushed cheeks and flushed cheeks. Okay, Soto syndrome. Next we have is Morquis syndrome. I hope you know that. Morquis is one of the MPS, mucopolysaccharidosis. We have various types of mucopolysaccharidosis like MPS1, MPS2. MPS1 is Hurler, MPS2 is Hunter. Morquis comes in which category? Can you answer for in the comment section? Samriddhi says, sir, are chocolates good for us? A little bit is fine. Little bit is fine. Okay. Yeah, Morquis syndrome. One thing I must remember, if I am having Morquis syndrome, my body will not be able to process some types of mucopolysaccharides. That's why it is one of the mucopolysaccharidosis. The patient will have a macrocephaly, number one, joint contracture, joint contracture, joint contracture, joint contracture, joint contracture, photographic memory, and the patient will have a sternal problem. Can you see that sternal problem? Can I write prominent sternum? Beautiful point, guys. It's very easy. Finish it off. Finish it off. Okay. Karan says dark chocolate is good. French paradox concept. Oh, that's nice. I actually like dark chocolate. Osama always he sends dark chocolate to me. That's very good. I love dark chocolate. Can I appreciate prominent sternum? Prominent sternum. Can I appreciate joint contracture? Joint contracture, and the patient will have macrocephaly. So the best answer for this question is, yeah, the patient will have a macro or micro, macrocephaly. Yes. So now the best answer for this question will be that Morquis will have macrocephaly, and what else? Weaver syndrome will have macrocephaly. Has everyone understood this much? Yes or yes, yes. Yes, Dr. Himanshu Kangwal, that's right. तू कौन से वाला हिमांशु है ब्रो? मुझे पता नहीं. Which Himanshu are you? Are you that Himanshu, the third year MBBS Himanshu? You are that Himanshu? We have four Himanshus in my third year MBBS in our batch. Which Himanshu you are? I'm not able to get it. Or you are some other Himanshu? Let me know. We have Himanshu Sharma. वो दूसरा Himanshu है. Belgium chocolates. Okay, that's nice. Okay. Pandey says, sir, what B if sternum is deficient? No, normal in this case, buddy, sternum is prominent. That's it. Okay. Has everyone understood this much? Please put a like button to this video, or you can give a golden heart, or a magenta heart, or a dark blue heart, or a dark pink heart. Please let me know. बिन तेरे बिन तेरे बिन तेरे कोई खलिश है हवाओं में बिन तेरे, है क्या ये जो तेरे मेरे दरमिया है, अनदेखी अनसुनी. That's right. Oh, that's right. Right. Okay, very good. Okay, let's go further. Before continuation, 10 more minutes, then we'll finish this class. Okay. Now we are cutting the classes to 40 minutes. Okay. 40 minutes, 40 minutes, 40 minutes, nothing more than that. Because I have to do recording also. I have to record 80 hours of lecture. That's why, dear. Yeah. That's right. There is no vision problem in Hunter. Yeah, that's very well put, my dear. Itne sare dil, literally. I should take a screenshot for this. Beautiful, 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 beautiful. Save two photos. Done. Osama, thank you. Shimanshu, thank you. Saurabh Tiwari, thank you. Good evening, sir. Good evening, doctor. My inspiration. Thank you. Thank you so much. And please, I recommend everyone to go to gym. Biceps are important. Today was my thigh. Monday, I hope Shubham, you're going to gym, bro. I recommend everyone Monday you should do thighs and Saturday you should do biceps. Why? Can you answer in the comment section? Why Monday you should do thighs and Saturday you should do biceps? Because on Monday, biceps or even chest also you can do. Why? Because Monday everyone will jump for chest only. So the thigh will be totally empty. And Saturday everyone will jump to thigh and Saturday chest will be totally empty. That is the reason. Before continuation of this slide, yes, Dr. Shiv, you're very, that's very well right. For cerebellum, you're very well right, my dear. Let's continue. Quick 10 more minutes. 9:15. I'll finish this class because I have to record the lecture from other things also. That's why. Uh, yeah. Yeah. जाना शुरू कर रहा है बस. जाना शुरू कर रहा है समझा नहीं मीडिया. कौन सा गाना, वो गाना याद आ गया. जाने तू या जाने ना माने तू. Yes, that's right. So don't downgrade your dream to fit your reality. Continuation slide. Don't downgrade your dream to fit your reality. Upgrade your conviction to match your destiny. Beautiful slide, beautiful quote. Don't downgrade your dream to fit your reality. Yesterday we had a very beautiful function on Saturday on Nurses platform. They are one of my favorite person. Should I show you that person's photo? Will you guess who is that person? Yes or no? One second. Let me show you one person photos, and he had told one very beautiful thing. Okay, let me show you. Do you want to see that person's picture? One second, one second, one second. Yes. So can you answer in the comment section, please? One second. 5, 4, 3, 2, 1. Who is this person? Who will answer? Yes or no? Yes. He's one of my favorite persons. His name is Dr. Rohan Khandelwal, and he's a very beautiful person, very amazing by nature. And I get the what do you call it? Yes, that's right. So I get the good luck to spend some few moments with him. And he had told a very beautiful thing. He had told that you should always dream big. You should always dream big. And if you dream big, big things will happen to you. अगर छोटी सोच रखेंगे या छोटे सपने रखेंगे तो छोटे ही रह जाएंगे. अगर बड़ी सोच रखेंगे, बड़ा सपना रखेंगे तो बड़े 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 हो जाएंगे. So he is one of the very beautiful, amazing person by heart. Very caring, very nice, very approachable, and I had a very wonderful time, and he's amazing in surgery, Dr. Rohan Khandelwal. So sir, today I'm sure you will never know that I am talking about you and I have your picture in my classes, but one thing I am want to tell you that thank you so much for the guidance, and you are a very good person, and I had a good time spending with you. Thank you so much. Thank you. कितनी अच्छी बात है ना. और he will never get to know that I ever spoke about him. So that's what. Oh, yes. Okay. That finishes this beautiful class, and let me ask you 5 random questions. And I hope, guys, this is a beautiful quote which says that don't downgrade your dream to fit your reality. Upgrade your conviction to match your destiny. Upgrade your conviction to match your destiny. It's a very beautiful quote. Don't downgrade your dream. If you want to have a BMW, you must have a BMW. I'm very happy with mine. It's just a 3 Series, but I'm really happy. So you should also have a Porsche or a Rolls Royce, something classy. But one beautiful advice I want to give you: you must have, first you should have assets. Okay, assets की spelling मेरे को ठीक से नहीं आती. Then you should think of kind of having a car, having a luxury, having an expensive watch or expensive shoes. Expensive watch, expensive car, and expensive shoes should only come that first you should have savings. Okay, invest, do some lot of investments. Okay, buy a land or maybe a share market or maybe some investment. Then once you are done with your investments, then you should plan to buy luxury. Don't buy luxury first. Do savings first and then do the luxury. Okay, so let's have a 5 random questions on this beautiful planet. Okay, Gabra1 gene mutation. Can you answer in the comment section, please? Gabra1 gene mutation, where do you say? Gabra1 gene mutation, who will tell? Yeah, that's right. Dr. Karan says Rolls Royce chahiye, Rolls Royce chahiye. Yeah, it's a beautiful car. I also want to buy it actually, but थोड़ी सस्ती है तो मैं सस्ती चीजें खरीदता नहीं actually. So Gabra1, yes. GABRA1 gene mutation you see in juvenile myoclonic epilepsy. That's one. GABRA1 gene mutation we see in juvenile myoclonic epilepsy. That's very well put. Number one. Number two, next important question. Okay. Omega shape epiglottis, the easiest question on this planet. Where do you see omega shape epiglottis? Yes or no? Yes or no? Yes. Omega shape epiglottis you see in a case of laryngomalacia. Laryngomalacia. That's very well put. Next question. What's the treatment for severe pneumonia? Can you beautifully answer in the comment section? What is the treatment for severe pneumonia? According to the IMNCI guidelines in the OP Guide 9th edition, what they have written, bro? IMNCI. What is IMNCI guidelines? Integrated management of the neonatal and childhood illnesses. Integrated management of the neonatal and childhood illnesses. IMNCI guidelines is a 5 marks MBBS question to the final year students. Once they see this question, they get a heart attack. I have never heard about it. Where this thing has come? It's there in OP Ghai. Go read. So that's what. Any idea? Yeah, that's very well put. The treatment of severe pneumonia is nothing but MP Genta. MP Genta. Ampicillin and gentamicin are the beautiful treatment for severe pneumonia, and then refer the patient if the saturation is 90% or less than 90%. I hope you know that fast breathing plus minus chest and drawing is pneumonia. Fast breathing plus minus chest and drawing plus danger signs is severe pneumonia. In a case of pneumonia, you give amoxicillin. In a case of severe pneumonia, you give MP Genta. MP Genta. Great, beautiful. Next question, please. Last question on this beautiful planet. What is the SpO2? What is the SpO2 of a newborn at third minute of life? Can you answer in the comment section, please? What is the SpO2? What is the SpO2 of a newborn? Yes, okay, okay. Karan says, हाँ bro, amoxi ka dose is 50 mg per kg per day. Dr. Karan Bikram Singh, in the case of pneumonia, once you give amoxicillin for 5 days, the dose of amoxicillin is 30 to 50 mg per kg per day. Gentamicin is 15 mg per kg per dose. 15 mg per kg per dose. That's right. Yeah, that's right. Okay, done. What is the SpO2 of a newborn at third minute of life? Okay, Osama says 90 to 95%. मरने वाले काम कौन करता है? ओसामा शेख। बेटा जान से मार दूंगा, सही आंसर कर दे। है बड़ी मेहनत से तेरे को पढ़ाया मैंने, ये आंसर करेगा तू? घर का है तेरा, तू अभी मिल मुझे बाहर। The SpO2 of a newborn at first minute of life is nothing but 60 to 65%. At second minute, third minute, fourth minute, fifth minute, and 10th minute. Very easy. At second, just increase 5-5, my dear. Just increase 5-5. Just remember one thing, my dear friends. The SpO2 of a newborn at first minute of life is 60 to 65%. At second minute of life is 65 to 70%. Third minute of life is 70 to 75%. Fourth minute of life it's 75 to 80%. Fifth minute of life it is 80 to 85%. And 10th minute पे 10 से बढ़ता है. By 10th minute it increases by varies by 10. Nothing but 85 to 95%. That's why the SpO2 of a newborn at the third minute of life is nothing but 70 to 75%. That finishes this beautiful class. Thank you so much everyone for this beautiful participation. Has everyone understood this much? Yes or yes, yes. It's 9:14. I have to finish the class by 9:15 because I have to do recording also. That's why. Then my mom will call. My mom is like, whole day you are teaching, you should take care of your health. Yes. Okay, great. That finishes this beautiful class. Thank you so much everyone for this beautiful participation. I hope you enjoyed the whole thing. And yes, yes. समझ में आया या नहीं आया? Yes or no? Okay, that's great. That's great. I hope you have understood. Yes. Before leaving, we have a very nice शायरी today. मैंने एक लिख के रखी हुई थी actually. It's in Punjabi. So I have a very nice शायरी, dude. I wrote it in Punjabi. It's written, इश्क सोच के कित्ता ते की कित्ता, इश्क सोच के कित्ता ते की कित्ता, दिल दे के लैंड दी आस रखी, एहो जिहा इश्क कित्ता ते की कित्ता. That's a very beautiful quote in Punjabi which says, इश्क सोच के कित्ता ते की कित्ता, दिल दे के लैंड दी आस रखी, एहो जिहा इश्क कित्ता ते की कित्ता. So if you are a Punjabi, you will understand. If you don't know Punjabi, oh, that's so sad. Thank you so much everyone for this beautiful participation. Rashmi, thank you so much for all the beautiful amazing support. And Himanshu says आप पढ़ाओ और ना समझ में आए, ऐसा हो सकता है. Yes brother, thank you brother, thank you so much. It's 9:16. Take care, bye bye. Day after tomorrow we're gonna have a class. Tomorrow I have a 10 to 12 hour session in the this one this कहाँ पे है? DPJ नहीं, MCI Gurukul. I have the class tomorrow and 9:30 a.m. If you are there coming tomorrow Gautam Nagar, come at 9:30 a.m. okay, and that's it. Thank you, take care, bye bye. Day after tomorrow we will have another class. Osama कह रहा है समझ तो नहीं आया पर बहुत अच्छा लगा. यस 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 ओके या वो ओसामा बहुत इजी है. मतलब ये मतलब ओसामा तेरे लिए मैं बोलता हूँ. अच्छा समझ में, अच्छा ठीक है, पंजाबी में ही ठीक है. और कोशिश करो इसको समझने की माय डियर ओसामा. एंड थैंक यू सो मच एवरीवन फॉर द ब्यूटीफुल लव एंड सपोर्ट. एंड ओसामा इसमें ये बोलता है कि इश्क सोच के किया तो क्या किया, इश्क सोच के किया तो क्या किया, और दिल देकर लेने की आस रखी, ऐसा इश्क किया तो क्या किया. इसको हिंदी में इसका ये मतलब है, इश्क सोच के किया तो क्या किया और दिल दे के लेने की आस रखी, ऐसा अगर इश्क किया तो क्या किया. तो ये इसका कोट है ब्रो. Thank you. Take care. Bye bye. Day after tomorrow, 8:30 p.m. we have a class on our beautiful pediatrics by Dr. Anand app. Till then, take care and bye bye.